Hi everyone, I'm Julie Kenville and I'm CEO at UHN Foundation. Welcome to our very first behind the scenes at UHN. And we are so excited this evening. Our first topic is going to be all about artificial intelligence in healthcare. 4 times a year, we're going to be welcoming you behind the scenes, virtually of course, but we're happy to do so, to hear some of the great stories at UHN. Now, you know UHN is the #1 hospital in Canada. It is the #3 hospital in the entire world, but most importantly, it's the #1 publicly funded hospital in the world. And the reason it is the #1 publicly funded hospital is because of all of you, our generous supporters, our community of support. Philanthropy makes the difference between quality and excellence. It is the most important source of revenue for innovation, for great projects, for big ideas. It allows us to launch research projects and apply for research grants. So in this United behind the scenes, we're going to share with you a number of stories of really great discoveries and advances in medicine that you have helped us bring to market, that you have helped us bring to the community. So today, we're talking about artificial intelligence in healthcare. Now, UHN Foundation and UHN are launching a big initiative to build an AI hub. We've recently hired the very first chief AI scientist in the country, Bo Wang, and we're really excited to bring together all of these great research projects that are already working in AI. I have to tell you, almost every day I'm presented with a new project, really exciting projects in a number of different healthcare programs that have to do with AI. So today we're bringing you one of these projects. I'm really happy to introduce to you our 2 first guests. And today we have Dr. Tom Forbes, Surgeon-in-Chief, Sprott Department of Surgery, James Wallace McCutcheon Chair at UHN, Dr. Amin Madani, Director, Surgical AI Research Academy at UHN. Welcome.
Thank you, Julie. Thanks for having us.
Dr. Madani, before we get started, can you please explain to our guests today, what is AI?
So artificial intelligence is really a broad way to look at it as the study of computer science and machines that enables algorithms to perform functions that are very similar to humans, like decision making and perception and things of that nature, that enables them to do things that are very creative and like that. And machine learning is a sub-form of artificial intelligence. Not entirely the same thing, but if you train an algorithm to do something, eventually it'll be able to do that on its own with data that it has never seen before, things that we thought initially only humans can do. So that's one way I would summarize what artificial intelligence is. And this technology has permeated everything in our society. There's AI algorithms that are, that can have conversations with you. There's AI algorithms that can perform art. What's more human than art, right? You can have AI algorithms that can do all sorts of things now. And probably in your life somewhere you've interacted with AI algorithms, whether or not you've known it or not.
Now you'll see at the bottom of your screen the Slido link. Please do submit your questions. We are blessed that we've already received a number of questions from some of you, so thank you so much. Please continue. Dr. Forbes, is AI going to replace surgeons? How is it impacting surgery?
Well, that's a great question, Julie, and I think maybe all of us and those viewers on the line are wondering that question as well, as whether the robots are coming to replace us. But I think I'm reminded of a line where, AI is not going to replace surgeons, but AI used by surgeons is going to replace surgeons who aren't using AI. So where I see this is there are a lot of tools at in a surgeon's toolbox, all the way from a scalpel to general anesthesia to sutures and ligatures. This is another very valuable tool, transformative tool to provide augmented surgery. And there have been some major advances in surgical disciplines over the years, a lot of them being developed here at UHN. But if you think of the major advances from the introduction of the scalpel to the introduction of general anesthesia, this is the next frontier in surgical advancement in the development of augmented surgery.
How important is UHN's role right now in the development of AI in surgery?
Well, I think we're foremost and integral. A lot of the things that are going to be developed in augmented surgery, in AI implementation in surgery, will not happen anywhere else, certainly in Canada and the world. And really we have an opportunity to continue to lead in this area. If it's not us, then it will not happen. If it's not from the generosity of our donors, it won't happen as well. And part of the big reason is that we have people, you mentioned Dr. Bo Wang, we have experts like Dr. Mandani who's implementing it into the operating room, and I think the viewers tonight will be very excited to hear some of the tools that he's already using every day.
Now, the viewers this evening are also patients, and they are loved ones of patients. How is AI going to improve the quality of care and the outcomes for them?
I think there's so many ways to look at that. You know, we use AI to improve, like you said, augment surgery. What does that mean? It means improve, you know, all the things that can potentially go wrong, all the things that can be optimized. It can be everything from a GPS in the operating room to guide your surgeons so that they can do a better job and minimize complications. It could be AI algorithms that automate and streamline the use of resources and the flow of patients. It could be AI algorithms that improve the educational experience of the next generation of doctors. It could be AI algorithms that predict who's going to do well after surgery and who's at high risk of complications or who's a better candidate for surgery. So it's a very multifaceted thing. It depends on the use case, but this technology is, you know, it can be applied for so many different things.
Can you help us understand a little bit the GPS concept?
Sure. I mean, that's a bit more of a, you know, proof of concept, I would say, than ready to be scaled. But basically, you know, surgeons, when we do surgery, you know, a lot of times, or most of the time, we study some imaging, some ultrasound or CT scan, and we have a mental model in our head, and then we just go for it. It's very different from pilots. You know, when pilots go fly a plane, they don't just fly a plane and go for it. They have an entire navigation system to guide them and to support them and to give them warning signals and really augment them in a way that they wouldn't be able to do it on their own. So that's kind of like what we want to do. We want to bring that kind of support system for surgeons in the operating room. It doesn't have to be something very fancy. It could just be something on the screen while they're doing surgery to give them, you know, advice or suggestion based on how the AI interprets the surgical field.
Now, Dr. Forbes, we heard that it could help in the preoperative and the postoperative. Can you help us understand how it might help?
Yeah, that's a very important concept, and as the viewers and the patients who are on the line may not be aware, but when they go to see a surgeon, when they go to see a physician with a specific ailment, there are often a number of options that your surgeon can provide you, all the way from medical management to an operation, and even at the operation level, it may be a very large operation or a very small operation. And what we currently use without artificial intelligence or without augmented surgical tools is what has happened to other people who might or may not be similar to you on the line. So we look at a population-based information. We say people with a specific situation or medical ailment, the outcomes are X, Y, or Z with a specific treatment. But what if we can take that patient's specific information and use a machine learning algorithm to have a more predictive outcome of what the best surgical intervention or medical management is with that patient. So I liken artificial intelligence in the preoperative phase to a prediction machine. It's really helping us take patient-specific information and to have a very accurate prediction as to what that patient's outcome would be so that Dr. Mandani can decide what is your best therapy.
So how do you balance that with your surgeon instincts and knowledge? You have information coming from AI, and you now have your own gut instincts. How do you balance? I'd love to hear both of you on this.
Sure. I mean, I think right now we kind of do that as surgeons. Like when we say our gut instinct, you know, somewhere in our brain, we take this avalanche of data and it all feeds into our brain, and we make a best decision as to what we should do for the patient in that moment of time. An AI algorithm is similar, but I think it can tolerate even more data than we can as humans. You can take all this avalanche of data, and even more than what we can, and really process that into producing an output that's more than just a gestalt and an internal feeling that you have, something a little bit more objective and statistical. So I think the way we're going to use this in the end is, like you said, is a tool, just like any other tool we have at our disposal. We don't ultimately let the AI make the decision for us, but we will access the AI algorithms to support us and to make better decisions. And ultimately, it's up to us to interpret that output from the AI algorithm in the way we think it's best for the patient.
I think if I could add, humans are very good at some things that maybe perhaps computers are not that great at yet. Maybe someday they will be. And some of that is some of the judgment decisions. And some of that is also the assessment of the individual patient's beliefs, what their priorities are. So part of the decision-making process when we see a patient is what's important to them. Often it's, I want to get home as healthy as quickly as possible. And taking these value judgments into effect can go alongside that sort of joint decision-making process now with the patient, perhaps with an AI tool, and with the physician.
So if I understand what you're trying to say is a patient might be kept in hospital longer because they're more at risk of infection, or is that what you mean, Dr. Forbes?
Yeah, I think it's, yes, and I think the machine learning or the artificial intelligence tools help us to predict some of those bad outcomes like infections or complications and steer us away from perhaps more dangerous therapies and towards more beneficial therapies. But I think also the humanistic approach to it allows us to bring in some of the value judgments of what's important to the patients, what's important to their family members as well, that maybe the mathematical models don't entirely capture.
Dr. Madani, you're running an entire research effort. Can you tell us a few of the exciting projects you're working on?
Yeah, they're all very exciting. I don't know, it's hard to choose, but I think I can tell you about some of the themes that we're doing. I think as we alluded earlier, the whole GPS in the operating room is one of my areas of interest. It's called computer vision. That's the area, literally computers seeing things, making sense of images and videos and interpreting them, doing things like detecting anatomy, detecting cancer and tumors, and telling us cut here or don't cut there. That's been an area of passion of mine for a few years now. And so that's one of the areas where we've been working on. And we've started with gallbladder surgeries, but we've then expanded to a variety of different areas like colon cancer and vascular surgery, my area, endocrine surgery. So that's an area of interest of mine. Another area that I'm very excited about, because I think it's one of those low-hanging fruits where we're going to be able to introduce in a clinical setting is the area of three-dimensional reconstructions of anatomy. So a lot of us, like who do complex cancer surgeries, sometimes we need a navigation, some kind of model that we can kind of visualize and see, so that when we're doing the surgery, we know we're taking out the whole tumor and we're not causing complications while we're doing that. So AI algorithms that can take your CT scan or your MRI before the surgery and then create a three-dimensional model, so your surgeon has that right then and there during the surgery, not from memory before your surgery, which is really key. We're going to start doing that for areas like breast cancer and other areas, so I'm super excited about that. Another area that I'm really excited about is, a lot of people have developed these AI algorithms. Certainly in the scientific community, everybody in different places is coming out with a new algorithm that can do this, or that. But no one's really figured out how to bring that AI algorithm into the operating room. Like, how do you integrate that into our workflow without, you can't bring big machines into the operating room without interfering with the surgeon, with the nurses, with other things. So building all the hardware and the design that goes into it so that you don't give like information overload, for instance, to the surgeon. All of that is part of the research that we do. Yeah.
Now, you're in the
I can go on and on.
You're in the operating room all day long, every day. You have a young baby at home. How do you have time to do all of this? When do you fit this into your week?
So I think there's a few ways to answer that. First of all, I have a great partner at home, very supportive. I have great, we have a lot of family support. That's one way. But I think my position is I'm a surgeon scientist, so half my work is clinical, the other half is academic research. So I try to split my time in a way that makes sense. I have an amazing team, in my lab who supports me and, so I can provide more of the leadership and the support. So it's a multifactorial thing, and also a lot of nights and weekends.
Now, important for our listeners, because I'm sure they're wondering this, you obviously get paid for the work that you do in the operating room, but how do you fund your lab and everything that goes on the side? How do you fund these great research projects?
So there's two main ways. The one is obviously philanthropy. That's one of the big ones. I was very fortunate. Someone by the name of Helga Schmidt donated money when I started at UHN 5 years ago. And so that startup money allowed me to start a lab. That was what's allowed me to hire the talent. These AI algorithms don't just fall out of a coconut tree. Like, you got to hire the talent to train these AI models and so on. So that money really helped pay for the salaries and things like that. All the hardware that we use to train the models and so on. And obviously grants. So we've been very competitive and very fortunate to getting academic peer-reviewed grants that allowed us to support the research. So those are the main two main streams. So we're very dependent on donors.
And last question in this line is, these projects you spoke about, are they in clinical trial? When do they become standard of care and they can be used all around the world?
Yeah, so there's a very robust process that we need to follow before it could be standard of care in the operating room or perioperatively, like in the clinic or elsewhere. We need to really get the evidence behind it. We need to make sure that the models do what we train it to do. We need to make sure that it actually improves patient outcomes and things like that. Right now, especially in my area, we're really at the stage of clinical trials. We're just rolling out our first clinical trials this year for the areas like breast cancer and gallbladder surgeries and things like that. But there are some areas where AI models are already in use. Like, there are medical devices that are approved, like in radiology, cardiology, dermatology. So there are things that are available in healthcare. In surgery, we're just a little bit behind. We're still at the clinical trials phase.
And what are the steps moving from clinical trial to the next step? Can you help our listeners understand what those steps are?
Yeah, so there's many different ways you can do clinical trials. You can start with something smaller and then scale it, then do multi-institutional. So do a clinical trial at different hospitals around the world, and then really demonstrate that people do really well when you use this intervention compared to what currently is the standard of care. And then once you've got the research to back it up, then you go into, okay, well, how do you implement this in the operating room? So that's where all that work we did with the design and the hardware and all that comes into play. Sometimes you work with companies to take your AI models and put it into some kind of product that you can scale. Or at UHN, we've been really good at this, is we've actually been building a lot of the scalable solutions as well. And then obviously you need approval from like Health Canada, FDA, so that they can give you approval for using it in the operating room. So there's a very long process to getting it out there, but we're on the right track.
Dr. Forbes, the quality of the machine learning is based on big data. And we have 1 million patient visits a year, but do we combine efforts? Do we join efforts with other hospitals around the world to be able to increase our access to data?
Sure. Yeah, no, excellent question, Julie. And I think, information is sort of seen as today's oil, right? It's the most valuable resource as the artificial economy sort of expands, and it's really inexhaustible. The more information, and it's not just what maybe some of the viewers might be concerned about personal information. It's data sets around imaging, all the little pixels from X-rays, all the numbers from lab work, all the pixels from pathology examinations, all these complex data sets that the more you feed the machine learning algorithm, the better it gets. And as it starts to see more variability in the data, there are more cases that it can predict on. So the more the better. I don't think there is a ceiling as to how much data is available. So to answer your question, UHN is a huge place, and the Toronto ecosystem in artificial intelligence and our other partner hospitals are huge, but there's only so much data, right? And so there's been a priority and recognition of that. There's been partnership with large organizations like the Mayo Clinic in the United States, where our leadership at our hospital has gone into some data sharing agreements. It's all de-identified. This is not identified data, so any data being uploaded from a patient is not, there's no identification, and the data remains, you know, in Canada, so there aren't those concerns. But when you start to talk about artificial intelligence and feeding information, that's where it's very important for us to keep a lens on that privacy aspect, because that's a justifiable concern by a lot of people.
So what else are we doing to protect privacy of our patients?
So, I mean, do you want to answer that in your individual research program?
Absolutely. So one of the areas for me is, you know, developing, let's take the GPS navigation example. You need videos, lots of videos of surgeries. And at UHN, even though we have very high volumes, it's nowhere near the numbers that we need to train these really good models. So I have to work with collaborators from all over the world, and we have to share videos essentially so that we can, you know, really it's a symbiotic relationship. We help each other out. You know, colleagues from like Korea, let's say, they send me videos so that we can train models and everybody benefits. So in terms of how do we protect patient privacy, you know, we have to, so we work with cloud service providers, for instance, to make sure that, you know, if data is transferred here, you know, how is it done in a way that's, you know, that respects all the laws and regulations. You know, we don't have any personal health information, everything's de-identified. You know, we got to be very, very robust about how we follow the rules, because the last thing we want is, you know, have any privacy issues that come later on. But yeah, that's all part of the research and the design. We have to make sure we have privacy officers, people that we work with, to make sure that everything is properly done.
And the only other thing I would add, Julie and Amin, is that, you know, the communication with the patients is so important, and we would really like all of our patients to partner with us as in the research initiatives, whether it's AI or otherwise. However, there has to be recognition that some patients may not want to share their information or their data, and that's fine. And that's fine. Yeah.
Please do continue to submit your questions so we can get to them today. Now, there are a lot of risks related to AI. You know, we've heard about deep fakes. We've heard about the possibility of the machines taking over on their own. What are we doing? Are you concerned about these risks?
I think, you know, those are definitely big risks and things that are worrisome. I think that right now we've been very careful about not using AI in a way that's not intended to use it. So, you know, we're never going to have the AI algorithm, at least not now, we're never going to have an AI algorithm make decisions about, you know, this is what the AI said and this is what's going to happen to the patient. There's always a human in the loop. Like if an AI makes a recommendation, it's ultimately the provider's decision to decide what to do with that data and how to use it. So I don't think we're going to see like robots walking around the hospital doing things anytime soon. I think because we're still in that phase, you know, a lot of those concerns about artificial intelligence are not really there in healthcare yet. So that's kind of been my perspective towards that.
Yeah, I mean, I think to add on that, one of the concerns that comes from the researchers and the experts in the field is the black box sort of status of some of these algorithms, in that there is a decision making that takes place, you know, in the computer. And we're not really sure how the algorithm is making that decision, and there may be some bias associated with it that we don't entirely recognize. And there have been some examples where in Dr. Madani's research program where some biases have been identified because the computer doesn't always think like a human might think, and so that's why it's really important for the human to have oversight, to have the judgment to make the final call. And I think that's the mentality going forward. I think the regulatory nature and the conservative steps and approach that we're taking will provide some safety.
So we're one of the leaders in the world in robotic surgery. Do you ever see, Dr. Forbes, that the AI would actually be the one leading the surgery and not the surgeon?
Yeah, interesting. I think if you had maybe 10 physicians in the room, you might have 11 opinions. You know, it's hard. Never say never or never say always, right? I mean, I think we're a far way off from fully automated surgery, if we ever get there. I think there'll always be some oversight or role for the human. Today, it's with a lot of hands-on experience and using it as an augmented tool. Could we see a shift where the human is doing less and there's a bit more automation? Well, we're seeing that in the self-driving cars, right? We're seeing, we've gone from GPS guidance to you can take a Waymo and you sit in the back seat and there's no driver. Not all of us are entirely comfortable with that, but we could see a stepwise progression in surgery towards that.
If I may, I think just for the viewers, when you think of robotic surgery, I think it's important to point out that it's not robotics in the sense of you have a robot doing things. It's kind of like, think about it like a fancy marionette that you control as a surgeon. That's really what it is. But as Tom pointed out, there will be increasingly roles for automation. We'll start with simple tasks and it'll become more and more complex. But like you said, we're not there yet. It's not like training AI on cars and pedestrians, and it's very different from training AI on surgical tissues and planes. The complexity is a totally different level. So we're nowhere near that.
Now let's talk about teaching, because education is a really important mandate for UHN. We have research, clinical care, and teaching. And can AI play a role in improving how we teach our students? I don't know, let's go first, Dr. Madani.
Sure, yeah. So my background's actually in education, and this is really a passion of mine. This is how I got into AI, is for the longest time we were trying to teach, how do I teach a young surgeon to think like an expert surgeon, and it was a lot of like simulation and teaching, and eventually we realized we can train AI algorithms to do that as well. But there's different ways you can improve and really facilitate the learning curve. A lot of those AI tools, like for instance, that will identify anatomy and pathology on the surgical field, you can actually use that for coaching purposes. So the first time we saw that GPS work a few years ago, my wife took a video of me watching the AI for the first time and I almost fell off my chair. But basically it's like my mental model, like the way I interpret and visualize the surgical field is now projected on the monitor, which was something I never thought was doable. And this isn't like anatomy that has very clear margins. This is very complex pattern recognition that we're talking about, something that takes years to really understand. So, you can use it for coaching purposes when you can replicate the thoughts and behaviors of expert surgeons. The second thing is you can also assess people as well. So a lot of times we think about, okay, when do you decide someone is ready to operate on patients? A lot of times it's gestalt, like I train, a young surgeon to become a fully licensed surgeon. Eventually I say, okay, no, they've reached a competency. They're able to do a surgery by themselves. But now we have more objective ways that we can do that. And there's a ton of AI algorithms that can actually tell you what level of expertise you have achieved, if you're safe, if you're not safe, and so on. So soon in the education world, we're going to see these AI algorithms used to give us feedback and be the coach and tell us whether or not we're reaching that bar that's necessary for us to go to the next level.
Dr. Forbes?
Yeah, very well said, Dr. Madani. And I think we talk about the democratization of surgery, and we have the benefit at UHN of having world-class surgeons, and more importantly, the patients have the benefit of having world-class surgeons. But that's not always the case around the world. And for Dr. Madani to teach a surgeon in another country or another province the skills that he's developed during his career, without AI tools, it means him hopping on a plane and getting there. Now he can transfer his expertise to a surgeon, to an operating room, for the benefit of the patient through these AI tools. So we can basically distribute the expertise that's at UHN to operating rooms around the world. We can also use some novel training environments like the Mitchner Institute for education, where we can bring, I am going to put air quotes, bring surgeons from around the world virtually to the Mitchner Institute to learn complex or even rudimentary surgery that they can then take back to their home institutions.
I'm going to pause on that just to make sure that our listeners know exactly what the Mitchner Institute is. So Dr. Forbes, can you take us through that?
So UHN is a very exciting place to work, and one of the advantages we have is the educational opportunities. So the Mitchner Institute is the only institute at a Canadian hospital that's an educational facility for healthcare providers. Now what I mean by that is it's not a medical school, it's not a nursing school, but for all the other people who work at the hospital, it's the leading educational facility for people to train there, and it also provides an opportunity for training, for bringing teams together to learn on different techniques, and that is all through another example of what's exciting about UHN, all through the example of philanthropy. Yeah.
Exactly. The entire simulation center for surgery was funded by philanthropy.
Yes.
And an incredible addition. Now, what struck me in doing the visit of the simulation center is that we now have, like in the aviation industry, surgeons are now practicing on machines and are being confronted with difficult situations during surgery so that they can practice their reflexes. Can you help our listeners understand what used to happen before we had a simulation center? When would the student become the surgeon?
Oh, I think it's through a lot of trial and error. I think the way surgery has worked for the longest time is no different than a sushi chef in Japan. It's an apprenticeship model, basically. You sit there and you assist again and again and again until you start to get every time a little bit more responsibility, a graduated responsibility, and eventually get more and more autonomy. And then once you're ready to hand off the reins to the trainee under supervision, and then eventually on their own, then that's how training is done. Unfortunately, sometimes that can lead to complications when you have a trainee. So as a surgeon who supervises a lot of residents and medical students, we have to always, we really have to be very careful when we do that, never to give the reins too early, but also provide them with the appropriate supervision and an environment to foster their development. Simulation centers are really amazing because they provide that environment where you can practice making decisions without risking patient safety. So it's really been a game changer for us, and certainly we use simulation centers quite extensively now. So when a surgeon wants to learn, for instance, how to do minimally invasive surgery, which is these keyhole surgeries where we put a camera inside the abdomen and then we watch a monitor and do surgery, we have these simulation environments where people can practice how to do that on inanimate objects, for instance, or pig models or bowel and so on, so that once you go into the real operating room, you've already gone up on your learning curve already.
Incredible. Dr. Forbes, can you help us understand how many learners we have and how does that compare to the rest of the country?
Well, we have hundreds of what we call fellows who are trained surgeons who come from all over the world to learn the advanced techniques that are performed every day at UHN. That's the largest fellowship program in Canada, one of the largest in the world. We have a very close collaboration and partnership with the University of Toronto, so all of our surgical programs bring our residents through UHN, and we're the largest site within the University of Toronto program, and that includes medical students and residents.
Wonderful. Now, we are in the process of building a $1.1 billion surgical tower at Toronto Western. Very exciting. Foundation has committed $300 million towards this new tower. Can you help us understand, one, how is surgery going to change with the tower, but two, how is AI going to impact the ambitions for the future?
Sure. A couple comments there. It's the excitement at UHN with respect to the development of the tower, which will open in 2028, which will be here before we know it. The excitement is palpable. I mean, walking the halls of Toronto Western especially, but also all of our sites. It's really the once-in-a-lifetime transformative development of UHN, of medicine in Toronto and Ontario and Canada, as well as surgical disciplines here at UHN. It's a long-awaited update, transformative development for our main sort of major programs at Toronto Western, which include neurosurgery, where our neurosurgeons treat some of the most complex brain tumors and spinal abnormalities and neurological disorders, spine surgery, orthopedic surgery, ophthalmology, plastic surgery, and hand surgery. So those are our pilot premier programs at Toronto Western, and this is a much needed innovation with respect to and development with respect to those programs. What we're looking at with respect to the tower, and I encourage any of the audience, if you're looking to come and do a little bit of a tour or get more information, please reach out, because we're really excited about doing a walk around. But what we're looking at the tower is 20 new operating rooms, state-of-the-art operating rooms where there's adoption of advanced imaging and technology and robotics and artificial intelligence tools, so that Dr. Madani and all of our surgical colleagues can really do modern age cutting edge surgery. Educational facilities that are linked to the Mitchner Institute and the Temerity Simulation Center, such that we can educate surgeons from around the world, both virtually and in person. Really novel and real attention to the patient experience as well as to the family experience. So the adoption of artificial intelligence goes beyond the operating room. It also goes into the patient and family experience, the patient rooms. So all the patient rooms will be single patient rooms, private rooms, with artificial intelligence tools assisting your healthcare team to monitor you, to monitor your vital signs, to identify where you might be getting sick, or hopefully when you're getting better and ready to basically advance to the next care step. So it's really a fully integrated electronic artificial intelligence, artificial intelligent integrated surgical tower.
So the technology will be able to monitor our patients 24/7 rather than nurse coming in a few times a day. And how is the AI contributing to that?
Yeah, and you can, so each AI will be integrated into the inpatient rooms to allow, we talk about augmented nursing, augmented healthcare. It's providing a new valuable tool. And imagine the impact on our providers, on our nurses, how excited they are to adopt this technology, but also they see the need and recognize the value in it in providing safer, better, more efficient care. And they can do what they're trained to do and use this technology to provide better care.
And how about in your case? Does AI, do you have more possibilities with the tower?
Absolutely, because this is, I think there's a lot of parallels going on. While the tower is being built, we're bringing a lot of these tools into fruition and making them available for the point of care in clinic or in the operating room. So once that happens, it'll be a perfect opportunity to start deploying it a little bit more, on a routine basis as opposed to a clinical trial. And the infrastructure is set up to integrate our AI algorithms. So it's extremely exciting.
Now, you're both very excited about AI in healthcare, but how are the other physicians feeling about it? Change management is always difficult in healthcare. Are they excited? Are they embracing it?
We've done a lot of research on this, especially because part of our work involves, speaking to the surgeons and saying, okay, if you had AI, how do you want the AI to help you or not help you, and so on. I've seen a lot of mixed emotions about it. Obviously, there's a lot of natural tendency to be skeptical about it, and rightfully so. I was a skeptic too. And on the other hand, people recognize that there's an opportunity as well. I think overall there's a positive sentiment, but there's also some skepticism, in terms of what are its limitations, and if an AI tells me this, but I think it's that, how do I do? And understanding how that interaction will occur. And obviously, we have to design the tool to account for all those situations. But overall, I feel like a lot of our colleagues have positive sentiments towards it, as long as it's designed in an appropriate way. If you think about, you talked about self-driving cars, we just bought a new car recently for the first time in a long time, and I noticed there's all these warning signals that are coming on, and I'm not used to it because my old car didn't have all that. So suddenly I'm driving and parking, and there's 60 signals going off that I'm about to hit all these obstacles. It's confusing. That we don't want something like that in the operating room. Like, a surgeon does not want 20 alarms to go off while they're doing something routine. So we have to figure out how to integrate that properly. And a lot of the sentiments of my colleagues have been to, vocalize some of those concerns.
Yeah, I think one of the other things to add is that these tools have the opportunity to allow more face-to-face contact between a doctor and a patient. And hopefully not at UHN, but I suspect many of the viewers have been in the doctor's office where their doctor has been staring at the computer screen for most of the time and maybe just listening to them outside. And that's because The doctor is also looking at your x-ray. You're trying to type up a note that goes to your family physician. And you may wonder, is that physician, is he or she even listening to me? One of the selling points to some of our colleagues is how can we make your life, how can we make your job a little bit easier so you can actually talk face-to-face with your patients like we are right here today. And there are the generative AI tools, the voice activation tools that are going to allow that to make the doctor's job a little bit easier and allow a bit more face-to-face contact. So I think that's an important concept as well.
Can you help us understand how it would do that?
So it's very exciting. I think I've seen examples of it. So for example, if I'm seeing you as a patient, Julie, and and you have come in with a sore toe, and I start a conversation with you, and that's right, and I ask you, well, when did it start? What does it feel like? Do you have any other medical conditions? Are you on any medication? What do you do for a living? When does it hurt? All the usual questions that we interrogate you with. I can look at you face to face asking you these questions. The tool in the background is accumulating all of this information, putting it into text in the form of a letter back to your family physician. So what the letter would look like, regardless of what order I've asked you these questions, it would say, "Dear Dr. Smith, it was a pleasure to see Julie today, who's had a 1-month history of right first toe pain that occurs at 5 p.m. in the evening," and whatever, but it puts it into that script. And that allows your doctor to look at you in the eye and have that conversation with you. Hopefully you feel a better doctor-patient interaction, and saves the doctor time so that they can also see more patients.
I think like one of the problems that a lot of our colleagues and everywhere will say is administrative burden on physicians is quite a lot. So I think a lot of these AI algorithms can potentially facilitate that. And I think it goes back to something which is really understanding the needs. And we really have to take the time to understand from our collaborators, our not just physicians, nurses, the biomed engineers, everybody in the healthcare team. What are the pain points? Where do things go wrong? Where can things get better? And then design the solutions around those needs. It's why is the 3-dimensional reconstruction so important for our cancer surgeons? Because half the doctors, surgeons that I speak to, they say, I wish I had the anatomy right there while I'm doing the surgery, so I don't have to go back and look at the CT scan during a case. Like all of these are like the pain points that really, will inform the design of this technology.
So our listeners are also donors and members of our community. I'm sure you're thinking a lot about where AI is going in healthcare and where it can make the biggest difference. How can our listeners help?
Go ahead.
I mean, I think there's so many different ways they can get involved. Obviously, philanthropy is one way. We're completely dependent on that. So that we can advance the research, the innovation, but also being involved in the research itself as well. Like a lot of our work has been engaging with patients and asking them, okay, so if you had the AI doing this, like would it help you? So for instance, one of our studies was looking at, asking breast cancer survivors, you've been through a lumpectomy for breast cancer. What if you had an AI that can show you this, to show you exactly what your surgery was, to improve the educational aspects so that you can be better prepared mentally for the surgery, and like that's something that was very important for them. So asking our patients to also get involved is I think really important too.
I mean, it's not an overstatement to say none of this is possible without the donors and with our viewers. I mean, we're always thankful for the funding we receive from the Ontario government, but we're one of 140 hospitals in the province, and they have a lot of responsibilities outside of healthcare, like building roads and education and all the other obligations. So UHN can't be UHN without without the support of our donors. Allow Dr. Madani, his teams, to advance this technology. And really the impact is a global impact because it goes outside of the operating room here. We talked about the democratization of these findings. We also have a very unique opportunity, Julie, in Toronto with the AI ecosystem that I think a lot of people are aware of. The godfather of AI just received the Nobel Prize, Jeff Hinton, who basically was working at the University of Toronto. And it's not just him, all the tethers of his influence, the computer scientists who are now working at UHN and at the University of Toronto. I mean, that's the second generation that's really providing the secret sauce for what we can do here.
Yeah, that's the beauty, isn't it? Like, you asked why UHN earlier, and I just couldn't help but think that one of the things I love about this place is you're in the ecosystem of AI. Like, all our work is so multidisciplinary. You know, I work with computer scientists, engineers, biomed engineers, game developers, like all sorts of, like, there's an entire cohort of people with different skill set that come into this. And in the Toronto biomedical hub is so rich of people that are very, you know, very skilled in this area. The Vector Institute is just around the corner. The Department of Computer Science is just around the corner. UHN has like a whole wealth of, you know, very smart clinicians to weigh in on how this technology gets developed. So that's one of the things I really love about this.
We have a lot of questions coming from the audience. Thank you so much. I'll just jump right into one of these. How will the use of AI be governed when faced with the choices that might otherwise be contrary to medical ethics or standards? Who would like to take that?
I think that's. I mean, obviously that's important, and we need to. A lot of work has been done prior to going down the path of some of these AI tools. I mean, obviously we rely on government regulatory agencies as well as institutional research ethic boards. So none of these projects are done without the oversight of the UHN Research Ethics Board, where there's a multidisciplinary panel that looks at, including patient partners, who look at some of these ethical concerns. The other impact that probably doesn't get talked a lot about with respect to these AI algorithms is the environmental impact and some of the energy requirements of some of these supercomputers, and that's a growing area of recognition. I don't know if you'd call it a concern, but recognition, and some of the power and resource requirements. And I think it's a bit of a segue, but we have a project here at UHN, our Green OR project, led by Dr. Laura Donahoe from the Division of Thoracic Surgery, and looking at things like that. What are the power requirements for our operating rooms, disposable versus reusable equipment? I mean, that's a whole other lens when you talk about the global impact of some of these new algorithms. Yep.
Yeah, and I would just add to that, you know, part of that question was, you know, if so let's say an AI says to do something, but it's not ethical in some way. I don't think we're at that point where we're letting AI make those decisions. I think these are augmentation tools right now to support and improve. They're never gonna, you know, they're not gonna decide who gets a transplant or who doesn't. So right now it's really to support the physicians, the surgical team, the whoever.
We have another question here, very interesting. Are there applications in which you think AI should never be used? If so, why?
I mean, I think part of that question implies, so hypothetically, assuming, you know, the technical piece is not an obstacle, assuming AI can do anything, I think there's certain things that you definitely don't want in AI, and I think those are the humanistic pieces of healthcare. Like, you're never going to have an AI, for instance, giving bad news to a patient, a chat bot that, you know, that's something that, you know, requires the human touch, like, you know, that, so there's certain things that we really have to be careful about, you know, the humanistic aspect of healthcare. That should not be an AI algorithm that does that. That's my personal perspective.
Yeah, and I think for the foreseeable future, probably for our lifetimes, you know, that element of judgment is still going to be a human parameter, right? And I think people, certainly I will accept tools that make my job easier and better and make patient care better, but the judgment and the expertise still aligns with an individual surgeon or physician.
How will AI impact immunotherapy? The complexity of the body chemistry seems significant with theoretical approaches impaired. Any comments on that? That's very specific.
Oh, I don't know. I don't have a background in immunotherapy, but I assume it's just like any cancer care, any therapeutics where we're seeing AI being used for tailored medicine, being able to take all this, like I said, avalanche of data around you in healthcare, whether it's your vital signs, your labs, your x-rays, your everything, and then be able to piece it together to say whether or not you're going to respond to immunotherapy or not. That's my basic understanding of immunotherapy. I admittedly don't have a background in that.
Yeah, I think it's an example of where we talk about one of the main areas of artificial intelligence is in personalized medicine, and really we can get down to the individual DNA or tumor characteristics, and really say very specifically what the best therapy is and what the prospective outcomes are. Like Amin says, it's using complex data sets where our traditional algorithms and mathematical models for evaluating those data sets were just suboptimal.
Like for instance, for cancer patients, they're now doing a lot of genetic testings to see, like you said, go again down to the DNA. We don't really have a lot of as humans, we don't have a lot of the knowledge to say what pattern of DNA is associated with good outcomes or bad outcomes. AI algorithms are really good at this, taking this huge data sets, many hundreds, thousands of patients' DNAs and figure out patterns that are associated with good outcomes or bad outcomes, or who's going to benefit and who's not going to benefit. That's one of the beauties outside my field, but definitely one of the areas I think are going to be super impactful.
Now, I know you're both surgeons, and we're here to talk about AI and surgery, but we do have a question about diagnostics, and AI is playing a huge role already. Dr. Forbes, would you be comfortable in telling us a little bit about what we're doing at UHN?
Yes, and I think looking back, some of the first manifestations of using AI tools was in radiology and pathology. So when you think about it, looking at pathology slides or a radiologic, let's take chest x-ray as an example, the way that a diagnostician or a radiologist may look at a chest x-ray is basically taking that data set and making an interpretation. And it's a prediction. There's an input, there's the visual input of what I see, and there's the output in my judgment of what that is. And it's a pattern recognition type challenge. And certainly in the diagnostic fields of pathology and radiology, some of these algorithms have proven just as good as a radiologist, or more importantly, a radiologist with this tool has been shown to be better than a radiologist without the tool. So where we're adopting some of these algorithms at UHN is in the digital pathology area. So our pathologists are world experts at looking at specimens, surgical specimens, biopsy specimens, and making a diagnosis that then dictates care. But there are a certain number of pathology specimens that are not overly complicated, and it's really just pattern recognition, and the pathologist is best suited to look at the more complicated biopsies. So if we can use machine learning algorithms to assist them with throughput in dealing with some of the less complicated samples, they can then designate and use their time on more complicated examples.
We have a question here about how do you talk about AI with your patients, if at all? Is it required when you're using an AI tool?
Personally, I haven't seen too many situations yet because a lot of the use cases are not in my subspecialty. Oftentimes, I have a patient who will ask me about the gallbladder algorithm if I'm doing surgery on their gallbladder. That would be kind of a rare situation, but most of the times I don't encounter that. Sometimes they ask me about the research and I tell them about it, but because in surgery a lot of our use cases are still we're just scratching kind of the surface. It's not like radiology. We haven't had too many questions regarding that.
Yeah, I certainly would welcome any questions from any of our patients. I have had some patients ask about, they may in their own experience had some experience with AI, but asked about, do you use advanced imaging in the operating room? How do you use some of the predictive analytics? What about all the information that's gathered when I'm in hospital? I have a blood work and there's a hemoglobin value. Are numbers like this used? So I have had some questions like that, but we're always welcome to those questions by patients and their families.
Now, one final question to both of you. Where is AI going in healthcare? Can you predict the future?
So at UHN as a leading institution, our vision is every operating room, every therapeutic environment has a tool that makes the physician's job easier, better, safer, more efficient for the patient. And a lot of those aspects, it will be large data being run through algorithms. It'll be computer vision in operating rooms like Dr. Madani. It'll be the incorporation of robotics. So I see artificial intelligence and machine learning algorithms as part of augmented therapeutics. And the specifics of the augmented therapeutics basically are designated what the doctor is trying to do. So laparoscopic cholecystectomy or having your gallbladder out, there will be that self-driving car, no-go zone that's going to prevent the physician from getting into trouble and having you have excellent outcomes. So that's where I think we're going to go. All aspects of UHN will have some augmented surgical tool.
Yeah, I think I would echo that, and I think we're going to see a lot of changes in our environment. Certainly as physicians, we're going to see new tools, new technologies, but I want to emphasize that it doesn't have to become this very futuristic environment necessarily. It could be as simple as an app on your phone. It could be as simple as a extra function on the monitor, something that we already have. I think a lot of the AI and the digitization of surgery is going to be occurring on the back end, on these cloud servers, and you're not going to see all these machines working, but it could be a simple tool that's going to assist your clinicians in doing something. Obviously, that's more in the near term, but obviously, who knows where this technology is going to go. One of the things that's so impressive to me is the technology and the innovation in machine learning is moving at such an accelerated pace. There's now AI algorithms that can take your CT scan and then create a deep fake surgery. So it looks like you can actually rehearse an operation before the fact and make it look so you can mentally rehearse a surgery. It's crazy how fast this technology is moving. So I don't really know where it's going to look like in 10 years, but
you'll be driving it.
Yes, hopefully.
We also had a question about where to obtain more information on the projects that were talked about today, and also on AI at UHN overall. You can find information on our website. Please do give us a call if you want additional information as well, or if you want to support one of these projects. As I mentioned, we are leading a campaign for $40 million to support all of our AI projects, to build this AI hub, to be able to hire enough team to be able to support the hundreds of projects that are already ongoing, and of course have seed funding for more projects. It is very expensive to develop new AI technology, but we also want to be partnering up with industry that is already developing technologies, and we want to be able to test them here in real time so that we can continue to be world leaders in this area. So thank you so much. Thank you, Dr. Forbes, Dr. Madani, for joining us today, and thank you to all of our viewers. We hope that you've learned a little bit today about AI and that you find it as exciting and interesting as we do. We also hope you'll join us again in January for our next United Behind the Scenes. Have a good evening.